The human colon acts as a main system for the human body. Here are some consequences of poor colon health. Before we jump into the video, please subscribe to the channel for more health and wellness information. Poor colon health can lead to various consequences and conditions. Some of the potential consequences of poor colon health include constipation. Insufficient fiber intake and inadequate hydration can lead to constipation. When stool moves slowly through the colon, it becomes harder and more difficult to pass. Constipation is a common digestive issue that can be related to colon health. It occurs when the stool moves too slowly through the colon, leading to difficulty and infrequency in bowel movements. Several factors, including diet, hydration, physical activity, and certain medical conditions, can contribute to constipation. Here's an elaboration on how constipation is related to colon health. Lack of fiber. A diet low in fiber is a common cause of constipation. Fiber adds bulk to the stool and helps it move through the colon more easily. Insufficient fiber intake can lead to hard, dry stools that are difficult to pass. Dehydration. Inadequate fluid intake can result in dehydration, leading to the hardening of stool. Water is crucial for softening the stool and promoting regular bowel movements. Inactivity. Lack of physical activity can contribute to sluggish bowel movements. Regular exercise helps stimulate the muscles in the digestive tract, promoting the movement of stool through the colon. Ignoring the urge to have a bowel movement. Ignoring the natural urge to have a bowel movement can lead to stool staying in the colon for an extended period. Over time, this can contribute to constipation. Certain medications. Some medications, such as certain pain relievers, antacids containing aluminum or calcium, certain antidepressants, and certain antispasmodic drugs, may contribute to constipation as a side effect. Neurological conditions. Conditions that affect the nerves controlling bowel movements, such as multiple sclerosis or Parkinson's disease, can lead to constipation. Hormonal changes. Hormonal changes, such as those occurring during pregnancy or menstruation, can affect bowel function and contribute to constipation. Colon disorders. Conditions affecting the colon, such as irritable bowel syndrome, IBS, colorectal strictures or colorectal cancer, can lead to changes in bowel habits, including constipation. Diverticulitis. Diverticula are small pouches that can form in the walls of the colon. If these pouches become inflamed or infected, it can result in a condition called diverticulitis, causing abdominal pain, fever, and changes in bowel habits. Diverticulitis is a condition that involves the inflammation or infection of small pouches, diverticula, that can develop in the walls of the colon. These pouches typically form when weak areas in the colon's muscular walls allow the inner lining to protrude outward. While diverticula themselves, a condition called diverticulosis, are common, not everyone with diverticula will develop diverticulitis. Here's an elaboration on how diverticulitis is related to colon health. Formation of diverticula. Diverticulosis. Diverticula are small, bulging pouches that can form along the digestive tract, most commonly in the colon. They are generally harmless and may not cause symptoms. Risk factors. Age, a low-fiber diet, lack of physical activity, obesity and smoking are some factors that may increase the risk of developing diverticula. Diverticulitis, inflammation or infection. Diverticulitis occurs when one or more diverticula become inflamed or infected. This can lead to symptoms such as abdominal pain, tenderness, fever, nausea, and changes in bowel habits. Complications. In severe cases, diverticulitis can lead to complications such as abscess formation, perforation of the colon, or the development of fistulas, abnormal connections between the colon and other organs. Management and prevention. Dietary changes, including increased fiber intake and lifestyle modifications, are often recommended for managing and preventing diverticulitis. In some cases, medications, or in severe cases, surgical intervention may be necessary. Diagnosis and treatment. Medical evaluation. Diagnosis involves a medical evaluation, which may include imaging tests such as a CT scan or colonoscopy to confirm the presence of diverticula and assess the severity of diverticulitis. Antibiotics. Treatment often includes antibiotics to address the infection, along with dietary changes and medications to manage symptoms. Surgery. In recurrent or severe cases, surgery may be recommended to remove affected portions of the colon. Colon polyps. These are small growths on the inner lining of the colon. While not always cancerous, some polyps can develop into colorectal cancer over time. Colorectal cancer. Prolonged poor colon health, especially with the presence of risk factors such as polyps, can increase the risk of colorectal cancer. Irritable bowel syndrome, IBS. Poor colon health can contribute to the development or exacerbation of irritable bowel syndrome, a functional gastrointestinal disorder characterized by abdominal pain, bloating, and changes in bowel habits. Hemorrhoids. Straining during bowel movements due to constipation or other issues can lead to the development of hemorrhoids, which are swollen veins in the rectum or anus. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis are forms of inflammatory bowel disease that can affect the colon. These conditions involve chronic inflammation and can cause symptoms such as abdominal pain, diarrhea, and weight loss. Nutrient absorption issues. A compromised colon may affect the absorption of nutrients, leading to deficiencies in essential vitamins and minerals. The colon is part of the digestive system and is located in the abdominal cavity. It is specifically a component of the large intestine, which is the final portion of the digestive tract. The colon follows the small intestine and is responsible for further processing and absorbing water and electrolytes from the undigested food material. The colon is a long tube-like organ that forms a large inverted U shape. It consists of several segments, each with a specific function. The main segments of the colon include ascending colon. This portion travels upward on the right side of the abdomen. Transverse colon. This segment runs horizontally across the abdomen, below the rib cage. Descending colon. It descends on the left side of the abdomen. Sigmoid colon. The sigmoid colon is an S-shaped portion that connects the descending colon to the rectum. The human colon, also known as the large intestine, is a part of the digestive system. Its main functions include absorption of water and electrolytes. The colon plays a crucial role in reabsorbing water and electrolytes from the undigested food matter that enters it from the small intestine. This absorption process helps in forming solid feces from the liquid chyme. Formation and storage of feces. The remaining undigested food, along with water and electrolytes, is formed into feces within the colon. The formed feces are stored in the rectum until they are ready to be eliminated from the body. Fermentation of undigested food. In the colon, bacteria help ferment undigested carbohydrates, producing gases and certain vitamins, such as vitamin K and some B vitamins. These gases are eventually released as flatulence. Storage of waste material. The colon acts as a temporary storage site for waste material before it is eliminated from the body during the process of defecation. Maintaining water balance. The colon is involved in maintaining the balance of water in the body. It absorbs water from the digested material to prevent dehydration. Maintaining a healthy colon involves incorporating a balanced and nutritious diet that supports digestive health. Here are some foods that are generally considered beneficial for the colon. High-fiber foods. Foods rich in dietary fiber promote regular bowel movements and contribute to overall colon health. Include fruits, vegetables, whole grains, and legumes in your diet. Examples include apples, berries, broccoli, spinach, quinoa, lentils. Probiotic-rich foods. Probiotics are beneficial bacteria that support a healthy gut microbiota. Foods containing probiotics can help maintain a balanced gut flora. Examples include yogurt with live and active cultures, kefir, fermented vegetables, for example, sauerkraut, kimchi, omega-3 fatty acids, Foods rich in omega-3 fatty acids have anti-inflammatory properties, which can be beneficial for overall digestive health. Include sources such as fatty fish, for example salmon mackerel, flax seeds, chia seeds, walnuts. Colorful vegetables. Vegetables with vibrant colors are often rich in antioxidants, which can help protect cells from damage. Include a variety of vegetables such as bell peppers, carrots, sweet potatoes, tomatoes, whole grains. Choose whole grains over refined grains to increase your fiber intake. Examples include brown rice, quinoa, oats, whole wheat. Lean proteins. Opt for lean protein sources to support muscle health without excessive saturated fats. Examples include skinless poultry, fish, legumes, tofu. Hydration. Drinking an adequate amount of water is essential for maintaining proper hydration and supporting digestion. Water helps soften stool and prevent constipation. Herbs and spices. Certain herbs and spices may have anti-inflammatory and digestive benefits. Consider incorporating ginger, turmeric, peppermint. Signs of a poor colon or potential issues with colon health can vary, and it's essential to pay attention to changes in bowel habits and overall digestive well-being. Here are some signs that may indicate problems with the colon. Constipation. Infrequent bowel movements or difficulty passing stool can be a sign of poor colon health. Constipation may result from a lack of fiber, dehydration, or other underlying issues. Diarrhea. Frequent and loose bowel movements may indicate an issue with the colon, such as inflammation or infection. Abdominal discomfort. Persistent abdominal pain, cramping, or discomfort may be a sign of various colon conditions, including irritable bowel syndrome, IBS, diverticulitis, or inflammatory bowel disease, IBD. Blood in stool. The presence of blood in the stool, either bright red or dark, can be a concerning sign and may indicate conditions such as hemorrhoids, colorectal polyps, or colorectal cancer. Unexplained weight loss. Significant and unexplained weight loss without changes in diet or activity levels may be associated with various gastrointestinal conditions, including issues affecting the colon. Changes in bowel habits. Any significant changes in bowel habits, such as a sudden increase or decrease in frequency, changes in stool consistency, or changes in color, should be addressed with a healthcare professional. Fatigue. Chronic fatigue that cannot be attributed to other factors may be associated with certain colon conditions, particularly those that involve inflammation. Incomplete emptying. Feeling that the bowels are not fully emptied after a bowel movement may be a sign of a functional or structural issue in the colon. Bloating and gas. Excessive gas, bloating, or discomfort may be related to digestive issues affecting the colon, such as excessive fermentation of undigested food. Thank you for watching. Please like the video and subscribe to the channel for more helpful information.